So along with the CMSE, you can also use instrumental evaluation procedures that will allow for you to characterize the patient's disorder even further. So for that, we use the endoscopy and acoustic analysis. For endoscopy, there's the nasopharyngeal fiber optic video endoscopy, which allows us to get a better look at the velopharyngeal and laryngeal valves, both at rest and at use. The K-Pentax is a part of the acoustic analysis. That motor speech program, it gathers information on different acoustic aspects of the voice, articulation, and prosody. And within patients with closed head injuries, we've seen the electroglottographic has shown evidence of dysphonia in those patients. Accelerometric has shown evidence of hypernasality in those patients. And the kinematic has shown evidence of articulatory dysfunction in those patients.